Have you ever actually stopped to wonder what keeps that heavy head of yours perfectly balanced on top of your spine all day long? Or think about this, how you manage to swallow your food and breathe at the exact same time without even consciously thinking about it. It is just an absolutely incredible feat of biological engineering. Well, to answer those questions, today we are going to dive right in and master neck muscles anatomy. I know, it might sound a little complex at first, but we are going to break it down really simply. In this explainer, we're exploring the fascinating networks of the anterior neck muscles, the lateral muscles, and those deep postural supporters. We're also going to look at a very special free-floating structure called the hyoid bone, which kind of acts as the anchor for the whole shebang. Just take a look at how these structural support pillars form this vital bridge connecting your head to your body. The main job of all these muscles is essentially twofold. First, they permit the super intricate movements of your neck and head. And second, they physically hold everything upright. It literally is a muscular masterpiece. And to really understand how it all fits together, we're going to do a layer-by-layer dissection. We'll basically peel back the anatomy from the outside in, looking at the muscles based on their location and depth, all the way down to the deep spine. So, let's start with section 1, superficial muscles. This is the outer layer of the anterior neck muscles. Now here's where it gets really interesting. These are the muscles you can actually feel and sometimes even see, right beneath your skin. Our first one, the platysma, isn't some bulky muscle. Instead, it's this wide, flat, sheet-like muscle located right in the front, the anterior compartment of the neck. It stretches all the way from your upper thorax and shoulders right up to the lower part of your face. And here's a totally surprising fact for you. Because it tenses the skin of the lower face and neck, this is actually the muscle responsible for producing your facial expressions of disgust, surprise, and horror. Crazy, right? Sitting right beneath that platysma, we have the sternocleidomastoid. You can see those prominent bands on the anterolateral sides of the neck. Now, despite that super long, intimidating name, its anatomy is actually pretty simple. It extends from the sternum and clavicle, so your collarbone area, all the way up to the base of your skull. It's a relatively long, superficial muscle that acts as a major rotator and flexor for your head. Moving right along to section 2, suprahyoid muscles, or the elevators of the hyoid bone. So if you've ever been curious about the really complex mechanics of swallowing, this group of muscles sitting just above the hyoid bone is your answer. Meet the suprahyoid team. This is made up of 4 paired muscles: the mylohyoid, geniohyoid, stylohyoid, and the digastric. And they all share one absolutely crucial practical function. They all elevate or pull up the hyoid bone. Let's look a bit closer at one of those in particular, the digastric muscle. It's actually composed of an anterior belly and a posterior belly. But how do those two connect? Well, they're joined by an intermediate tendon that passes through a U-shaped loop of fibrous tissue attached right to the hyoid bone. You guys, it acts exactly like a mechanical pulley system. This loop lets the tendon smoothly slide back and forth to transfer the pulling force. It is just built-in body mechanics at its absolute finest. To really picture how this whole neck setup functions, I want you to imagine a giant tug of war. The suprahyoid muscles we just talked about are the elevators. They're actively pulling the hyoid bone up. But to keep that bone perfectly balanced and stabilized, we obviously need an opposing team pulling down. This delicate tug-of-war balance is literally what allows us to speak and swallow smoothly. So, who's on the other side pulling down? That brings us to section 3, infrahyoid muscles, the anterior strap muscles. Now, this part of the anatomy is actually often misunderstood by beginners. Why? Because they sit right below those elevators we just talked about, but they do the exact opposite job. Situated right below the hyoid bone are 4 flat, paired muscles, and because of their long, flat appearance, anatomists literally refer to them as the strap muscles. While the suprahyoids elevate, these infrahyoid muscles share the common job of depressing or pulling down the hyoid bone. A really perfect example of an infrahyoid muscle in action is the sternohyoid. It stretches right between the clavicle, sternum, and hyoid bone. Let's ground this in reality for a second. Every single time you speak or chew or swallow your food, this thin, flat muscle is actively firing to pull the hyoid bone downwards. It's constantly maintaining that perfect tug-of-war balance in your throat. Okay, section 4, scalene muscles, the breathing assistants. Let's shift our focus slightly away from the front of the throat to the sides of the neck. You might actually be pretty surprised to learn how your neck muscles assist your lungs. Positioned deeply in the lateral compartment of the neck, we have the 3 paired scalene muscles, the anterior, middle, and posterior scalenes. Think of them kind of like stabilizing guy wires on a tall radio tower. They extend downwards from the cervical vertebrae, your neck spine, and connect directly onto your upper two ribs. To see why this is absolutely crucial, let's just zoom in on the anterior scalene. Because it anchors directly to the ribcage, it is medically classified as an accessory muscle of inspiration. What that means is, when you are totally out of breath, say after a really long run, and you need to take a massive forced inhale, this specific neck muscle contracts to physically lift your upper ribs. It expands your chest cavity so your lungs can gulp in more air. Seriously, your neck literally helps you breathe. And finally, Section 5, suboccipital muscles, the deep supporters of the head. We've officially reached the core. Let's peel back those very last layers to reveal the deepest muscles. Tucked right at the base of the skull is the rectus capitis posterior major muscle. It's this short, sort of triangular-shaped muscle that connects your second cervical vertebra directly to the occipital bone of your skull. It acts as a deep foundational pillar. Without this tiny but incredibly mighty muscle providing essential postural support and head extension, there is no way you'd be able to comfortably hold your head up straight to look at the screen right now. All right, let's quickly review our layer-by-layer dissection. We started superficially at the front with the platysma, our sheet-like muscle of facial expression. Then we moved deeper to the hyoid bone, where we saw that perfect tug-of-war balance between the elevating suprahyoid muscles and the depressing infrahyoid strap muscles. After that, we saw the lateral scalenes acting like guy wires to literally help us breathe. And finally, we uncovered the deep suboccipital pillars, keeping our heads held high. The human body truly is a mechanical marvel, isn't it? So I have to ask you, which neck muscle's function surprised you the most today? Was it the platysma showing disgust, the literal pulley system of the digastric, or the scalenes helping you breathe? Let me know down in the comments below and make sure to hit subscribe for more simple medical explanations.